Recover, and this is Ericka Mizuta, founder, CEO, and doctor of physical therapy. And today we wanted to make a video to explain what quality physical therapy looks like.
So over my 20 years of experience, and actually haven't owned private practice since 2009, I decided to have a practice that has quality care and really focuses on the patient. And so I wanted to let you guys know what that looks like. Because when you go into a traditional clinic, you're going to see a lot of different people working there. You're going to see usually a physical therapist, a PTA, and an aide. And I get questions all the time from patients because I specialize in complex patients that I actually see for an hour by myself. They're not quite sure what those different people are doing and what their education level is. So that's what we want to discuss today. So I wanted to ask Mary, have you ever been to physical therapy before?
I have. I went once for a knee injury, and I think I saw the therapist for about 15 minutes, and then I was handed off to a technician to do some exercises.
So, and was any of that explained to you when you went to that clinic, like what the education level was of the therapist or even that technician that you saw? Did you understand who they were?
I did not.
Yeah, and that's what I find happens most often. So, when you go to physical therapy, whether it be in person or a telehealth visit, you should always be assessed by a physical therapist for the first visit. That's the law throughout the country and obviously in the state of California. So a physical therapist now has a doctorate degree. I graduated in 2003 with a doctorate degree, so I have 20 years of experience working with that degree. So we assess a patient, we figure out what the problem is, and then we create a plan of care. Now, there are clinics that use PTAs, and a PTA, what their role is that the second visit, they can take the plan that the physical therapist has made. So the physical therapist may say, this person has knee pain and it's because their hamstring is weak. The PTA has the knowledge of how to create a hamstring strengthening program, but they are not by law able to assess a patient. So you can't have a PTA actually look at a patient and say, they have this knee issue because of a hamstring weakness and they need to go to physical therapy for 8 visits. The PTA is not allowed to do that. So the physical therapist must do it. Now, clinics will use aides or techs, and a lot of times that's kind of at the end of physical therapy. The therapist may come in, see a patient for a few minutes, and then they hand them off to the tech that does exercises. Now, I was a tech when I was in PT school. And a tech is a person that honestly is somebody that's in college that's usually majoring or wants to go to physical therapy school, maybe majoring in kinesiology, athletic training, something in that field, but they're not actually 100% trained to correct you with exercises or to really give you instructions. So when you go to physical therapy, the best advice is, number one, if you can, and this is what my clinic does in San Diego, is that we only employ physical therapists. I don't have any aides or techs, and I don't have any PTAs. So we specialize in complex patients, and so they see a physical therapist for a whole hour treatment one-on-one. But if you go to a clinic that employs PTAs or employs techs, make sure that you're asking really good quality questions to either the PT or the PTA. The tech may or may not be able to answer those questions. And if you have specific exercise questions and you're not sure if you're doing things correctly, that instruction should definitely come from the PT or the PTA. So that's kind of the difference in quality physical therapy. And this is one of the things with Recover is that we know that a lot of patients need to see a high-level specialist that may do something that other therapists don't. For example, vertigo is one. I treat patients with vertigo. Not all therapists are trained in that. A lot of these specialties we learn after PT school, and so you actually want to look for a specialist that does those type of patients. You can't just go to a general physical therapist because you may not be connecting with the right person. So at Recover, that's what we actually do through a telehealth platform. We connect you with specialists that may or may not be in your area, but that might be hard to find in order to aid in your recovery.
So follow us for more videos from Recover.